Welcome back everyone. Today I'm going to show you some exercises for the SIJ joint, also known as the sacroiliac joint. The sacroiliac joint is composed of two large hip bones joining to the sacrum, which is the tailbone, and this joint can cause a lot of pain and refer pain from the hip down the leg, and also mimics a lot of sciatica pain. It can cause pain in the lower back and obviously the hip as well. The SIJ joint plays a huge role in shock absorption, so if you're doing a lot of running and lifting, this joint is very important, and also stabilizes the hip and the lower back. So if there's poor stability here, it can cause a lot of pain and obviously cause injury in the lower back or even the hip as well. So I hope these exercises help you as much as they help me and my patients.
Knee to chest stretch. Keep one knee bent and the other extended straight out onto the floor. Draw one knee into your chest by grabbing the top of your shin bone just under the front of your knee. Lengthen your spine all the way down to your tailbone and avoid lifting up your hips, a bit like tucking your tailbone in. Now breathe deeply, releasing any tension that you have in your body. Hold this pose for about 1 to 3 minutes and repeat the process onto the other leg 3 to 4 times. This will stretch your glutes and slightly decompress the lumbar spine by lengthening out the muscles that run along the tailbone up to your spine, mobilizing your SIJ joint. This is a great way to stretch and decompress your lower back, especially if your lower back muscles are spasming and you can't get out of bed due to the pain. Some of my patients do this stretch to allow them to get out of the bed in the morning. This stretch relaxes your hips, your thighs, your glutes, and promoting overall relaxation. PIRIFORMIS glute stretch. Sit on the floor and then place the leg you are trying to stretch over your opposite knee. And then try to draw the knee from the leg that you are trying to stretch towards your opposite shoulder. I find that it helped by me looking away from the stretch. This will draw the opposite shoulder towards the knee. You should feel a slight stretch on the side of the hip or your bum. Hold this position for about 30 seconds and repeat on both sides 4 to 5 times. The piriformis can cause hip pain and even sciatic symptoms. So if you notice that this stretch has helped you relieve some sciatic symptoms, please try out my other piriformis videos on this channel. A research paper was published in 2018 by the Journal of Bodywork and Movement Therapies, comparing manual manipulation against stabilization exercises on sacroiliac joint dysfunctions in patients through randomized clinical trials. The results showed that both groups significantly improved when they were assessed for pain, and there was no significant difference between each group, meaning manual therapy is just as effective as exercise therapy and vice versa for acute and chronic sacroiliac dysfunctions. Hip flexor quad stretch. Go into a kneeling lunge position and try to have all your knee joints starting out in a squared bent position. Then push and thrust slowly, imagining that you're pushing an arrow through your hips to the front with your glutes squeezed. I like to support my knee with something soft like a folded towel. That way I can concentrate on the stretch instead of possibly hurting my knee that's on the floor. Now, if you do have anterior hip tilt and you want to do this stretch to prevent anterior hip tilt, don't stretch the hips in anterior hip tilt position, meaning tilting hips forward, but instead be mindful of the positioning of your hips and rotate your hips back into posterior tilt position, a bit like tucking in your tailbone. This will help promote posterior hip tilt and help combat the opposing position, which is anterior hip tilt. Hold this stretch for about 30 seconds and alternate both sides 4 to 5 times. Lower back rotational stretches. Just lay on the floor and grab the knee from the opposite side and pull it over to the same side of your hand. Now, in a relaxed manner, allow your other arm to be outstretched towards the other direction. This will act as a counterbalance to promote your upper back to be against the floor. This will stretch your lower back, your hip muscles on an angle. You might hear some pops and cracks in the lower back as your lower back loosens up and your joints start moving, especially your hip joint. However, please do not force these pops and cracks, as you may hurt yourself and create hypermobility, and your muscles might spasm even more and causing more pain. Hold this stretch for about 10 deep long breaths or even 30 seconds and repeat it on both sides 4 to 5 times. If you want to increase the intensity of this stretch, just extend your leg out to create more torque on the body. This will increase the stretch. By breathing in a relaxed manner, your body will relax more and create a better stretch. This is one of my favorite stretches I give to people after they do a long run or heavy lifting, or in weightlifting or powerlifting. I noticed that my patients gained a lot of pain relief and were able to resume with their daily tasks the following day, especially doing this stretch on a daily basis. Glute kickbacks. Go on all fours with your shoulders over your hands and your hips are over your knees. Whilst keeping a neutral spine and your knees are at 90 degrees, extend your hips and pull your heels up straight to the ceiling. An important cue I like you to keep in mind with is try not to move your lumbar spine too much. Otherwise, you'll create unnecessary twisting in the spine, and that makes this exercise redundant and not effective. At the end of each kickback or heel lift, I want you to squeeze your glutes and try to keep your abdominal wall activated. Pretty much activate your core on every movement. This way, you'll be training your core and your lower back and your glutes at the same time. Try not to flex your head back and forth on each movement. Do this for about 10 to 15 repetitions on both sides, 3 to 4 sets. This exercise normally isolates the glute muscles and commonly is used to build the glute muscles and tone the buttock. But it's also used as an activation drill for some athletes as well. The glute kickback is also known as the donkey kick, since it makes you look like a donkey kicking back with their hind legs. The reason why I want you to do this exercise is because it reintroduces the movement back into the SIJ joint and also strengthens the hip muscles that is surrounding the SI joint as well, therefore preventing injuries in the future and also reducing pain at the same time. Banded frog bridges. To do a frog bridge, just lay on the ground and place the bottom of your feet together, letting your knees open out like a butterfly stretch. The closer you have your feet towards your crotch, the more mobility you probably need for this exercise, and this exercise becomes a lot harder. I recommend arranging yourself in a position that is most comfortable for you first to try out this exercise before trying to go into a position that you have to require more mobility. Keep your elbows on the ground, then thrust your hips up as you keep your feet on the ground. Make sure you squeeze your glutes at the top of the bridge. Do this for about 10 to 15 repetitions for 3 to 4 sets. Please keep your core engaged and slightly press into the ground with your arms as you thrust your hips up. This way, you won't drive your hips over your head, but instead drive your hips up, activating the right muscles, which is the lower back, the PIRIFORMIS muscles, the external rotators of your hip, and also your glute muscles as well. And that's what we're trying to achieve to strengthen the SIJ joint and create some mobility in that joint again. Now, if you feel it too much in your hips or the exercise is too hard for you, that means your heels are too close to your crotch. Just bring it away from your body or not as close to your body and then do the exercise. This should make it a lot easier. That way you'll be using your glute muscles more and not so much the external rotators of your hip. However, if you find this exercise too easy, you can always increase the intensity by using a resistance band. I'll put a link in the description box below. This will strengthen your hip muscles and your external rotators of the hips. The band will try to pull your knees in on each rep, making you activate your hip muscles and external rotators a lot more, therefore increasing the intensity of this exercise. This exercise compresses the SIJ joint and then mobilize it as you relax on the release on each rep. Hopefully it will give you some relief and also prevent you from injury and pain in the future.
Once again, guys, thanks for watching. I want you to join my VIP Facebook group. I want to build a community there where you can ask questions and I'll try my best to answer them. There'll be other health professionals in that group as well to help you out. Now, if you do have sciatic symptoms, please check out my PIRIFORMIS massage video. That video will definitely help you out. If you do have PIRIFORMIS syndrome, so a muscle around the hip that could be squeezing on the sciatic nerve and replicating sciatic symptoms and pain down the leg. Now, if you're pretty sure you have sciatica and you want to test yourself to see if you do have sciatica, check out my sciatica test video. That video will help you make a decision on whether you do have sciatica or not, via a disc bulge, a disc herniation, or an impingement from the lower back down into the leg. And that way you will know if you have sciatica and you know where to go from there. Remember to support my channel, hit like, hit subscribe, comment below if you have any questions, and I'll see you guys in the next one.